We want to talk about why children should be getting vaccinated. I know that there's, people trying to decide should they, shouldn't they, what's going on. Well, I have an RN with me in studio, Intermountain Healthcare. Hey, Miss Katrina, thanks for being in studio with me. You're actually in studio with me, which is a really big deal. So, hooray! How are you?
Doing well.
Good. Okay, so let's talk about this. First of all, should kids get vaccinated? In what ages?
Yeah, absolutely. We're really trying to strongly encourage parents to get their kids vaccinated. 12 and older now has been approved. The CDC has strongly recommended that all 12 and older young people get vaccinated. Really safe. Studies have been done. Everyone's vetted it. We have the most, the smartest group of doctors in Utah that around the country that have all been involved in all this research. The Pfizer is a 2-shot. One of the reasons that we are really strongly recommending this, of course, is that we have seen some very serious cases of COVID in children in Utah, almost 80 kids with this complicated case called MIS-C, which affects the heart, the lungs, the skin, the kidneys, the brain, and these kids are in the ICU. They are not just, with a cough and a sniffly nose.
It's serious.
So if that was your child, you really would go, yeah, this vaccine is super important. So as we know, Jenny, our population we have a lot of kids in Utah.
We do, yes.
30% of our population in Utah are children under the age of 18. So in order for our state to really get on this vaccine and really get our state protected, we really have to vaccinate our kids, different than other states, for example, where they don't have as many children as we do.
Okay, so 12 to 17 should be getting vaccinated.
Yes.
Is it just the Pfizer vaccine that they get?
Yes, correct. 12 to 16 is the Pfizer, yes. And that is what we're trying to encourage. And so people that are unsure, that have questions, please talk to your primary care provider, your pediatrician, your family practice. Get those well child visits scheduled. Take that opportunity to go in and get those questions answered if you have them, because that's your trusted provider. That is, you have that relationship with them, super trusting. So, very smart to do that. The other thing to know is that kids, if they get vaccinated, won't have to wear masks. They can participate in sports. They'll be safe to go to school. They're really going to have a great rest of the summer and the fall.
They're going to feel a little bit more normal, which I think is what a lot of us are starting to feel now that, I know that for me, once I got my second dose, I felt, it was like this euphoria, like, oh my gosh, and you feel so secure too.
It's some freedom because we have lost a lot of our usual freedoms, if you will, since this all started.
Well, and it makes your entire home even more safe, by having less children, bringing that vaccine into your home. Tell me this, are people, having their kids under the age of 12 get vaccinated, or can you not even until you're 12?
No, you cannot. Not yet. So we'll be waiting for that. That'll be the next phase. But right now it's 12 and older. Please look up intermountainhealthcare.org. Talk to your provider. Lots of places. I just saw Park City has the Eccles. They're doing vaccines at the Eccles building. Just all over the place. Wherever you live, find out where those are being offered, and they're free of charge, of course. So no concern there.
Well, and if some kids are watching right now, because I know kids are out for school and maybe mom and dad aren't watching, maybe the kids can encourage mom and dad to get their vaccine too, right? Because I know that there are some people that don't want to as well, but if the whole family could do it, it's just going to be that much more safe for your entire family.
That's right.
Yeah. Okay, well, you've got it on the screen right there. You can call to schedule a vaccine appointment with Intermountain Healthcare. You can call the number. You can go to their website. Either way, get your vaccines. We all want to be healthy. We want our population to be healthy as well. Thanks so much for being here, Katrina.
My pleasure.